Hey, this is Laura Garding and Tasha Serpa. We are presenting together. Our topic is what is a vertically integrated healthcare network? What the first question is what is a multi-hospital system? A multi-hospital system is two or more acute care facilities owned, leased, sponsored, or contract managed by a central organization. As a system grows through acquisition of more facilities and through expansion, they experience benefits that result from this ownership model. Multi-hospital systems are predominantly not-for-profit, but can also be for-profit. Multi-hospital systems own provider organizations, so they own hospitals, clinics, physician group practices, kind of some other things there. The revenues and profits from these owned facilities consolidate at the corporate level. Some multi-hospital systems also manage provider organizations under contract for other entities. In this case, under a contract managed model, the operating profits or losses accrue to the owner, not to the managing entity. Multi-hospital systems do not own captive health insurance companies. So some examples of multi-hospital systems, which you guys may have heard of some of these. I know I definitely had when we were researching this. Providence Health System, which is huge in the city that I'm living in. John Hopkins Health System, the Mayo Clinic, Centara Health, and Kaiser Permanente.
All right, this is Tasha Serpa, and I'm going to take over now. First, I'd like to introduce who is Paul Starr, and we did some research this week. And Paul Starr did not set out to predict the future of healthcare, but he played a key role in 1982 by predicting that the healthcare world would be primarily integrated, controlled, and would steer from nonprofit organizations into polycorporate structures. So he foresaw vertical integration with a focus on HMO, insurance plans. And there was a rise of vertical integration at a very rapid pace in the 90s. And their focus of vertical integration was being controlled on a national, regional system. But over time, research found that most of these systems were not regional and local. So we also studied again this week on his predictions and why they were wrong, and the following reasons were local connections were not deemed as a threat or recognized, and a huge factor was the not-for-profit facilities were resilient, and they've stayed strong currently, and they also assumed that pressures on the hospitals would be unrelenting and unidirectional. So some components of a fully integrated health system that I found through research was first, a value-driven governance and leadership. So the board is focused on integration and it's relevant for all the stakeholders. Number two, being the hospital-physician alignment. A system is clear on aligning and integrating clinicians with the hospital administration. Third is the financial integration aspect, being that the system is well prepared for assuming risk-based payment and the ability to manage contractual relationship with payers. Fourth was clinical integration. So they provide a full range of services to meet the patient demands for preventative, ambulatory, acute, post-acute, and behavioral health. Number five was continuity, electronic health records, which are very popular now. EHR are accessible to all providers, so they all have access to all the patients' electronic health records. And number six was a patient-centered and population health focus, meaning they have a complete data on the socio-demographic utilization costs and health status on the population that they serve. So we talked about insurance and the role in the future of integration and just some different aspects of insurance, and what they foresee is their efforts to control healthcare costs are encouraging with vertical integration in the health services industry. The restructuring is uniting the financing and delivery of health services into one organizational structure. And current trends in health insurance suggest that the principal insurance products of vertically integrated systems will be carefully managed to reduce unnecessary utilization. So as integrated health systems come to dominate the markets of health insurance and medical services, the hospital industry, they foresee it as being dramatically affected. Hospitals being the principal cost centers, while insurance products will be the principal sources of revenue in integrated systems. And accordingly, management will face incentives to minimize hospital utilization where they will sell and convert excess hospital assets. Okay, sorry. So what is a vertical integration in the healthcare network? A vertically integrated healthcare system is an arrangement whereby a healthcare organization offers, either directly or through others, a broad range of patient care and support services. And I know you guys are getting sick of hearing my voice, but just some other key points of vertical integration. The main thing is it is focused and it's created under a corporate umbrella. So their main focus is on quality care for the patients, support services, and it's cost efficient for the community and facility alike. So vertical integration will focus on grouping organizations with different specialties and different levels of care, but again, under the same management. That's the key point, I think, to focus in regards to vertical integration. It's the hospital, the physician, and the insurance, again, under one corporate umbrella. So there's been a great deal of provider integration over the last 15 years. Earlier, I mentioned in the 90s, it was very rapid. As you can see, from 1994 to 2000, there was over 900 deals. It slowed down a lot, but something that I found in my research was physicians like virtual integration, as they can remain independent while exploiting the advantages of a group practice, such as having the centralized administration, risk spreading, and leverage within health plans. And again, you guys still are listening to me. So the future of integrated healthcare plans, something that we've talked about is the ACA, the Affordable Care Act plan. Medicare plays a cost in that. So they will release rules for healthcare organizations that they must follow, which will affect the cost and quality of care to a defined population. Some studies have found financial performance in integrated systems, but there's also some studies that have found none at all. So, for example, Denver Health reported a reduction in ER visits and inpatient stays once they had the integrated healthcare systems. They've had studies that showed staff satisfaction, cooperation, teamwork, communication, and that the frontline staff themselves felt more challenged. But overall, the outcomes are still mixed, although they do see a positive association between integrations with higher quality and efficiency. And the roles, we touched on this real quick, but the roles of the healthcare staff, hospitals, and insurance companies, you get the corporate umbrella. The physicians are employed, they're contracted, they're salaried, they're not paid just on diagnostics. The hospital having their comprehensive medical records, and again, the health insurance, there's more own networks, and you also get fixed dollar amounts. And just want to touch real quick on horizontal integration versus vertical. You're going to hear this term a lot. We've already kind of covered what vertical integration is, but horizontal was the first stepping stones, and horizontal was when companies would merge one with another with similar services, whereas vertical integration, there is typically an increase of value for that current facility under that corporate umbrella. And some examples of the integrated healthcare networks are Intermountain Healthcare, Banner Health, and Centara.
Yeah, sorry, my microphone is muted. And then one really last important note, and this for me kind of like brought it all together for some reason. I was having a little bit of a hard time comprehending it all, and this just kind of made it all click. It's that all integrated healthcare networks are multi-hospital systems, but not all multi-hospital systems are integrated healthcare networks because they don't operate their own health insurance companies. And then we have our sources here, and that is the end.
Yay!